But I can move my tray closer to my patient. I'm touching the outside of this. I'm moving it up between their legs. I'm going to wash my hands with my alcohol-based hand sanitizer. Okay. So one of the benefits of having the alcohol-based hand sanitizer right in the tray, of course, is that they don't have to turn their back on their patient. They don't have to turn their back on the tray that's in front of them. Okay, so the final flap is going to come toward the clinician, and we're not going to grab it here. We're not going to, manhandle it. We're just, there's a fold here. So the last flap comes toward us, and then right on top is our sterile gloves. So, or our sterile gloves. Again, another caution, when you're picking up your sterile gloves, you don't want to reach into your field. You want to just pick up from the top here. You're going to don your sterile gloves in a location separate from your Foley catheter tray. So it's either going to be, I have some room here on the bed, but if I had a bedside table, I could use my bedside table, or I could use a Mayo stand. When you're doing your demo for these two in front of the clinician, make sure that you open your gloves up nicely, because this wrapping has a tendency to flop back over, and it's kind of hard to demonstrate. See, just like that. All right. So open up your gloves, and then, the right hand goes in, palm side up, and you can touch the inside of the cuff by pinching to pull them on, but you don't want to touch the outside with your clean hands. So I'm pinching the inside of the cuff, palm is up, my right hand is in, and I'm just going to leave it like this for now with my cuff, because I can't straighten it yet. So now your second glove, you're going to go in with a C shape and scoop up your glove on the outside of the cuff. You don't want to touch the inside of the cuff with your sterile gloves. Okay. All right. So at the bedside, this was always the time when I felt like, okay, I could finally exhale. So now I can straighten out my cuff so that it's clear over my forearms or my wrists. I'm going to pick up the paper or the wrapping from the inside, from the center, so that nothing's going to flap on my sterile gloves, and I'm going to drop it into the garbage. Okay, now I can touch the inside of my sterile field. Remember, the outer inch of any sterile field is considered contaminated, so you don't want to touch the outside inch. You always, once you have your sterile gloves on, you want to move from the center. And then you want to take your box, and you actually want to move the box away from the patient. So again, mindful of that outer inch of your field, but moving it away, and then taking the tray top and moving it closer to your patient. The next step is the sterile fenestrated drape. So again, you can pick this up in any manner. You're sterile, you can touch everything, or you're aseptic, and this can actually go on in either direction. So you can see my model there. You can either put this on going in this direction or to the side. It really, to me, and from my experience, it depends on the girth of the patient. And what you want to prevent from happening is this falling over on itself and onto your field, because once it touches the patient, now it's not, now it's contaminated. So I'm going to put mine sideways. Okay. All right. Now we're going to finish up with the preparation step, which is preparing, this plastic portion of our tray. So shake down your PVI and open it up. And again, throw in the garbage. Take your 3 swab sticks completely out and squeeze the remaining PVI on top of your swab sticks, and then throw this away. My garbage is so far down there. I'm just going to set this over here. Okay, so next step is to get your lubricant onto your tray, and it's really important at this point that you dispense the lubricant lengthwise. Okay, so pop the lid. Now, one of the other pieces of this is what happens if they support injecting lubricant into the male patient. Just know that if that's part of their policy, another question you want to make sure that you ask is if they are going to be observing for the order in which they do that, because every time I've seen an injection done, they've actually injected into the male first, into the urethra, and then they take the syringe and they dispense onto the tray. So essentially, they've got a contaminated syringe because they put it into the patient, and now they're spraying or spreading the lubricant all over that Foley. So since this is a female, I'm just going to spread this lubricant lengthwise, and I'm going to dispense all of it. I'm not going to put any of this on my patient, and I'm going to dispose of this. Okay. And then I'm going to attach my water syringe. This is another very common step that gets missed, is attaching the syringe, the water syringe. I've seen some variation in practice in terms of when this gets attached. Several nurses have actually completed the procedure. So they've completely inserted the Foley catheter, and then they pick this up and they attach to the Foley. So I'm going to attach now. Okay. And then this is the time when you're taking the blue sheath off, and you want them to be really careful about removing that blue sheath, because oftentimes they let it flop around, right? So, and then you're going to place your Foley into your lubricant, and it will actually hold it rather nicely. Another step that they may take at this point is to take the Foley, or to, take all these contents actually completely out. But if you'll watch here, as I'm manipulating this, my catheter might have a tendency to flop around. So just if they're taking this step, understand that they can do that. They just need to be really careful that their catheter isn't flapping around outside of their field. So this is going to go away. All right. And this is a urine meter. This is actually a temp sensing. Yeah, I have a temp sensing, so I've got a whole lot going on here. But now, I kind of consider it like a timeout point, almost like they do in surgery, to just look over my stuff. Okay, I've got it connected. I've got my PVI swab sticks out. My catheter is lubricated. I'm ready to go. All right, so now I can move into contaminating one of my hands by touching the patient and my patient cleansing. So this is a piece of variation that I see a lot, is they'll touch the patient and they'll come back and forth multiple times between the swab sticks, or if it's cotton balls, that they're using, they come back and they're trying to pick up the cotton balls and separate them after they've already touched the patient. So just know, once my left hand touches this patient, my left hand is there to stay. So I'm going to separate the labia, and you want to make sure they also have a good grip, for lack of a better term, because what they want to avoid also is allowing the labia to slip and fall back in front of the urethra, because then that contaminates. So swab sticks, there are 3, left, right, and center. They want to go top to bottom on the female 3 times. Another place that you will see some variation is they stick to those principles that they learned early on with central line dressing care, and they'll actually start at the urethra, even on a female, and they'll do the circle, and then they'll work their way out. So just know that's a contaminant, right? You know that. Okay, so top to bottom 3 times. Start far away. 1, and then this goes into the garbage. Go down the one closest to you. And it is helpful to turn the swab stick on its side. Throw that away. The last one, right down the center. And then throw that away. Okay, now I haven't moved my hands. The labia are still open. It's all clean. Now I'm ready to insert the Foley. Be sure to hold the Foley far enough away so your fingers aren't at risk of touching the patient, but close enough so that you're not having this flop around. And this is going to come forward. And then one of the coaching pieces, again, that you can have is how much, okay, once they see urine, how much further do you want them to insert the Foley catheter? And that some may say, oh, a little bit further, some may say a couple of inches, some may say to the bifurcation. But just make sure you and your contact all have the same answer that you're looking for, right? So now my Foley is inserted. I've seen urine. It's a female. I'm going to go 2 to 3 more inches. And now I'm going to inflate my balloon, right? So I can actually hold here, inflate my catheter balloon. And you're going to use all 10 mLs. And then take the syringe off, throw that away. Pull the catheter back to seat, and at this point your procedure is completed, so you can pull this back. Now you need to remove your gloves because now your gloves are contaminated and you want to get everything cleaned up, so you're going to take these gloves off. They have the option